If you have knee pain, you have probably been told the same thing by every doctor. Rest it, ice it, take anti-inflammatories. And if those do not work, we can talk about surgery. But here is what nobody tells you. Most knee pain is not a structural problem that requires cutting you open. It is a strength and movement problem that requires getting you stronger. And the research overwhelmingly supports this. A massive 2018 study published in the British Journal of Sports Medicine analyzed over 6,000 patients with knee osteoarthritis. They compared physical therapy and exercise to arthroscopic knee surgery. The result? There was no significant difference in outcomes. Exercise was just as effective as surgery for improving pain and function. Without the risks, without the recovery time, and without the $15,000 hospital bill. Here is what is actually happening with most knee pain. Your knee joint sits between your hip and your ankle. It is the middleman. When the muscles above it, your glutes and hip stabilizers, are weak or not firing properly, your knee takes the brunt of forces it was never designed to handle. When the muscles below it, your calves and ankle stabilizers, are tight and immobile, the same thing happens. Your knee is the innocent victim of lazy neighbors. The first thing to address is your glutes, specifically your gluteus medius, the muscle on the side of your hip. When this muscle is weak, your femur rotates inward and your knee collapses inward during movements like squatting, walking downstairs, or even just standing. This inward collapse, called knee valgus, places enormous stress on the medial side of your knee joint and the patellar tendon. The fix is simpler than you think. Clamshells, side-lying leg raises, banded lateral walks, monster walks. These look like physical therapy exercises because they are. They specifically target and activate the gluteus medius. Do 2 to 3 sets of 15 to 20 reps, 3 to 4 times per week. You will feel a deep burn in the side of your hip. That burn is your glute medius waking up after years of being asleep at the wheel. The second crucial area is your quadriceps, especially the vastus medialis oblique, or VMO, the teardrop-shaped muscle just above your kneecap on the inner side. This muscle is critical for proper patellar tracking. When it is weak, your kneecap does not glide smoothly in its groove, causing friction, inflammation, and pain. The best exercise for this is the terminal knee extension with a band. The third area most people completely ignore is ankle mobility. If your ankles are stiff, especially in dorsiflexion, the ability to pull your toes toward your shin, your body compensates by collapsing your arch and internally rotating your lower leg. This forces your knee into a compromised position. You cannot have healthy knees with stiff ankles. They are connected by a chain of bones and muscles, and the chain is only as strong as its weakest link. Fix your ankle mobility with 2 simple drills. First, the kneeling dorsiflexion stretch. Kneel on one knee with the other foot flat on the floor. Drive your knee forward over your toes as far as you can without your heel lifting. Hold for 5 seconds and repeat for 10 reps. Second, calf raises on a step. Lower your heels below the step level and rise up onto your toes. Full range of motion. Your calves are probably tighter than guitar strings from years of sitting and wearing shoes with elevated heels. Now here is something counterintuitive. Once you have addressed the muscle imbalances, you need to load the knee, not avoid loading it. Load it progressively. Studies consistently show that appropriate loading of the knee joint stimulates cartilage repair, increases synovial fluid production, which lubricates the joint and strengthens the tendons and ligaments. The old advice of avoiding activity with knee pain is outdated and harmful. Motion is lotion. Start with bodyweight squats to a boxer chair, not full depth. Just to the point where you feel a stretch but no pain. Do 2 to 3 sets of 10 to 15 reps. Focus on perfect form. Knees tracking over toes, chest up, weight in your heels. As this becomes comfortable, remove the box and gradually increase your depth over weeks. Then add weight. A goblet squat holding a dumbbell against your chest is the perfect progression. Walking backwards is one of the most underrated knee rehab tools in existence. When you walk backwards, you engage your quadriceps differently. You reduce compressive forces on the kneecap, and you train the exact muscles that stabilize the knee during forward movement. 10 to 15 minutes of backwards walking, either on a treadmill turned off or on flat ground, 2 to 3 times per week. It looks strange, but it works. Here is your complete knee rehab protocol. Monday and Thursday, glute activation, clamshells, lateral band walks, 2 to 3 sets of each before your workout. Terminal knee extensions, 2 to 3 sets of 15. Body weight or goblet squats, 3 sets of 10 to 12. Finish with backwards walking for 10 minutes. Tuesday and Friday, ankle mobility drills, calf stretches and raises. Wednesday and weekends, rest or light walking. Do this consistently for 6 to 8 weeks, and most people will experience significant pain reduction. I have seen clients go from not being able to walk downstairs without gripping the handrail to squatting with weight pain-free. Your knees are not fragile. They are strong and adaptable. They just need the right stimulus, the right support, and the right progression. Give them what they need, and they will give you decades of pain-free movement. Hit subscribe. See you in the next one.